Are you getting pain down your leg? Maybe it's that burning pain, that sharp pain. It's shooting down, maybe up to the calf, down to the foot, down to the toes. It could be going down the buttocks. You're getting numbness, tingling, weakness going down that leg. And yet, when people look at you, or when you go see a healthcare practitioner, they know it's not your leg. It's coming from your back. What is that? It's probably sciatica, your sciatic nerve. Or in this case, we also call it a radiculopathy. Watch this video. I'm going to explain to you what's going on, what the problem is, and how we address it. My name is Dr. Alykhan Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And in our clinic, we serve patients from Oshawa, Curtis, Bowmanville, Whitby, and we have clients that come in with this symptomatology. They're talking about pain going down their leg, shooting down their leg, numbness, tingling, a dull, achy sensation, their leg giving out, and they're getting scared. They're fearful. They don't know what's going on. They're having challenges now, and they can't, stand at the kitchen counter to pick up their child. And they need clarity. They need direction. And this video is part of a full series that I do on the discs in your spine to understand exactly what the problems are and what the symptomatology is. So I'm going to encourage you to like this channel. I'm going to like this video and subscribe to this channel, because as you subscribe to this channel, you're going to get notified when I create more content, more videos that's going to help educate you further on what's going on here, what the problems are, and what the solutions can be when it comes to your spine and your discs. Let's get started. So let's understand this spinal anatomy and what's going on here. So let's talk about the spine. First and foremost, you have the spinal cord. The spinal cord is going down the center of the spine and through the vertebral canal. The vertebral canal is the canal that's within the vertebrae as they're stacked upon each other. And there are 23 vertebrae. There are 7 cervical vertebrae, 12 thoracic, 5 lumbar, and they form within them. There's a canal that the spinal cord travels down and giving off nerves, branches to each end. So you can see here that the spinal cord is going through this canal, down the center, and it's giving off branches to either side. These are nerves that are innervating your whole body. Now, when we get into the lumbar spine, there's 5 lumbar vertebrae, but then there's also the sacrum. The sacrum is a fusion of 5 vertebrae fused together, and this happens as you're growing up until the age of in your 20s and stuff. This is now fused into one bone. But you'll also see this is kind of like a horse's tail. You look at that, and that's what it looks like. It looks like a horse's tail and stuff. Now, let's talk about the sciatic nerve. The sciatic nerve is the thickest nerve in the body, and it's a fusion of branches that are given off from 5 nerves. It's everything from L4, L5, S1, S2, S3. So it's going from the bottom of the lumbar spine and through the sacral spine. A branch is given off by those nerves to form the sciatic nerve, which is your thickest nerve in your body. Now that sciatic nerve goes down your leg. It goes right down to your toes. So if you think about it, if that nerve gets irritated, it's going to create any type of sensation down that leg to your toes, right past the knee into your toes. And so that's an important thing to understand. So when you talk about that numbness, tingling, the weakness, any of those things that are occurring, the sharp pain, the electric pain, the lightning pain, the dull, achy sensation, it could be from that nerve being irritated. But it's not your leg that's the problem. It's where it's coming from, the spine, the back. And that's where the focus needs to be. And sometimes a case may get mismanaged because they're looking at the wrong area. And we should be looking at the spinal system, because that's where the nerves are getting irritated. And if they're getting irritated there, it's going to create problems going down the leg, whether it be a disc bulge, to a disc herniation, to a misalignment in that nervous system where the vertebrae are misaligned and creating that problem. It could be any of that. And as a chiropractor, anybody who comes into my office, I know I'm going to be doing a very thorough analysis. I do not adjust anybody on the first visit. I want to do my analysis, whether it be a history, a physical assessment, neurological testing, orthopedic testing, a computerized spinal scan that I do for all my patients that come in, as well as a set of x-rays to understand what the problem is. And the beauty is, I like to get things done quickly and understand what's going on. So I do the x-rays. I have my own x-ray facility in my clinic. Therefore, I can do the x-rays here, and I can view the x-rays here. I can mark the x-rays here, and I can be ready for the case in a short period of time with that patient to be able to address it and help them start getting better. Now let's understand what could be occurring when that sciatic nerve is being affected. And understand that sciatic nerve is given branches from the L3, L4, S1, L5. All these different nerve roots are giving branches to make up that sciatic nerve, which means the problem a lot of times is not in your leg, it could be in your back. And that means that that nerve root could be affected. So it could be the L3 component, it could be the L4 component. How do you know what's going on? How do you know where it is? Well, one of the things we use is called dermatomes. A lot of practitioners will understand the dermatomes and what's being affected. And what that means is that that nerve root affects one area of your body. And so when you're talking about the L3, well, the L3 nerve, the dermatome, the area that could be affected is the inner thigh. Then when you get into the L4 area, now you're talking about the front of the thigh, the top of the knee. You get into the L5 nerve root, well, now you're talking the front of the shin, the top of the foot, the first 3 toes. You talk about S1, well, now you talk about the back of the shin, okay, that could be affected. So there's different areas that get affected when that nerve root is affected, and we know it by dermatomes. And there's 2 different types of pains we're talking about. We're talking about a radiculopathy. A radiculopathy is where the nerve root is being hit, and you'll see that dermatomal type pain. The other one is more called a somatic type pain, and that's where the nerve root isn't affected, but let's say, great example here is the facet joints. If you look at the vertebrae here, you'll see how the vertebrae, this is the front, this is the back. These little joints here are called the facet joints. They help to hold the vertebrae in place, okay? And those facet joints are like lock and key joints. Now, if they get irritated, they can refer pain. So a referral of a pain may not be in that area, but it could be coming from somewhere. And that's a somatic pain because it's not a nerve root irritation. Yes, a nerve root irritation can refer pain too, along the pathway of that nerve. So hopefully you understand that distinction between a radiculopathy and a somatic pain. So now the question is, what caused this? How did this occur? Well, there's multiple causes. One cause is a posterior lateral disc herniation, and L4, L5, L5, S1. These are the most common areas that you'll tend to see this. And I see this in my clinic that comes in. And a posterior lateral disc herniation can create this type of symptomatology where the sciatic nerve gets affected and it's affecting you down that leg. And if you haven't done so, I would encourage you to watch my videos that talk about disc herniations as well as disc bulges to understand what a disc herniation is. The other condition that could be affecting this, it could be a stenosis condition. Stenosis is a very serious condition. You tend to see it in people over the age of 40, 50. And it's something that if you want to learn more about, again, I've done a whole series of videos on stenosis to help you understand that and how you can manage that. But when stenosis starts to happen, that's due to changes arthritically, degeneration that's occurring within the spine. And that's things like degenerative disc disease, your ligamentum flavum getting hypertrophic and stuff. These are the things that start to occur when a stenosis is starting to come into play, and that could be affecting your sciatic nerve. The third thing I see in my office, and it's actually quite common, is what's called piriformis syndrome. And so somebody comes in with piriformis syndrome, that's going to create the sciatic nerve irritation. And what is piriformis syndrome? Piriformis is a muscle in your buttocks area, and that muscle helps to internally and externally rotate the hip. That muscle is extremely important because when your body is developing, the sciatic nerve, this being the piriformis muscle, the sciatic nerve either goes underneath the muscle or pierces the muscle. And so when that muscle starts to spasm, becomes extremely tight, it's going to irritate that nerve and create your pain down the leg. So when somebody comes in to see me, that's an important thing to address and figure out, because an MRI is not going to pick that up. An MRI will not show you that you have piriformis syndrome. So I'll have to do specific testing in the clinic to help identify if that piriformis muscle is on fire and creating that sciatic nerve pain. Now, you could also have that sciatic nerve could be irritated by one of the previous things I talked about and have a piriformis condition on top of that. So it's really important to do a proper assessment to know what it is, what the causes are, and if there's multiple causes that could be creating this. Now, I get a lot of patients that come see me from, Oshawa, Whitby, Curtis, Bowmanville, and some of them are commuters. And the commuters will sometimes have this problem, and especially when they're sitting for long periods of time commuting, and then the desk workers that are sitting for long periods of time, and especially if you're sitting on a hard chair. Think about that. If you've got a piriformis issue, if you've got a sciatic problem and you're sitting on a hard chair, or you're not sitting properly, or you're slouching, and we tend to do that when we're sitting for long periods of time. We tend to bring our shoulders in, we tend to lean forward. That can create more stress on that disc, that can create more stress on that nerve, that can create more stress on that piriformis muscle. And that could be also impacting it too, creating those symptoms. Now, the other thing to understand is, when does it become a medical emergency? Well, these are the things you want to look for a medical emergency. It's that you find that you're starting to lose all sensation around this area. We call it the saddle area. When you're starting to lose all sensation around this area, accompanied especially by bowel bladder issues. You've lost function of your bowel bladder. That becomes a concern. And that is something that you are going directly to a medical doctor for, or you're going right to Emerge to get that addressed. So how do we address this when somebody comes into the clinic? The first thing is having a proper diagnosis. That's extremely important. And that involves having a proper analysis technique system to know exactly what's going on. When somebody comes into our office, we're not just doing a history and throwing them on the table and adjusting them. That makes no sense. You have to have proper diagnostic tools and procedures in place to know what's going on. So, as well as doing a history, we're going to do a physical assessment, orthopedic testing. That's very important, especially coming into a piriformis syndrome, to understand what's going on. We will do a computerized spinal scan to understand what nerves are being affected, where it's being affected, and we'll do our own set of x-rays. And the beauty is we have our own x-ray facility in our clinic that we can do our own x-rays and see what the issue is. Upon that, once we figure out what the problem is and where it's coming from, then we put together a solution plan. And we're going to talk about chiropractic care, adjusting that nervous system to help reduce the tension off the spinal cord. We will talk about things like possibly massage therapy if it's needed and stuff, to refer to a massage therapist as well as the chiropractic care. We'll talk about stretching techniques. And I'm going to tell you right now, stay tuned, keep on watching this video, because near the end, I'm going to show you a great stretch that you can do that's a game changer and a reliever. So keep watching. We also talk about acupuncture. We have an acupuncturist in this clinic. Her name is Maureen, and she does amazing work. So we sometimes bring that involved, especially when it comes to a sciatica or a piriformis syndrome. Great results with regards to that. So it's having that dynamic approach, the conservative approach, to help improve it, to help facilitate that improvement. So we're not looking at surgery as the first option. And in some cases, you may need surgery, but doesn't it make more sense to take a conservative approach and see what can be done? Because who wants to get surgery first? If you can manage it conservatively and start getting it better, then surgery may not have to be an option at all. And that is a huge game changer, because then you start getting back into your life and doing the things you love to do without fear or restrictions or less restrictions. One important term I want to make clear is that sciatica is not a diagnosis. We use it as a diagnosis. I feel a lot of people do when they come into my office. It's not a diagnosis. It's actually a symptom. It just means pain down your leg. It can be caused by many different things. And that's where the analysis comes in to understand what is causing it. Is it a piriformis syndrome? Is it a facet syndrome? Is it a disc herniation? What is it that's creating this sciatica? And thereby, when you understand what's creating it, you understand how to actually treat it. And that's important. So sciatica is a symptom. It's not a diagnosis. But when you have this, you want to take care of it. And here's that stretch I was talking about. You're going to see it on the screen right now, called the figure 4 hip stretch. You can do this seated or lying. We're going to show it to you in a seated position because I prefer getting patients to do it in a seated position. This stretch focuses on the muscles around the hips and the pelvis, which help to play a major role in how stress is transferred from the lower back and the spine. So to begin, you first choose a position that feels comfortable. And as I said, you can do it seated or lying. I prefer the seated position. Gently place one ankle over the opposite knee, forming a figure 4 shape. Make sure you're not forcing the position. The knee should fall naturally, okay? At this point, I don't want you pushing down on the knee. From here, stay upright if seated, okay? Or relaxed if lying down. You should feel a gentle stretch through the hip and the outer glute area, not in the back of the leg, okay? Then, okay, as you want to increase the tension, and this is to your comfort zone, you can lean forward from the hips, okay? And you feel a little more of a stretch. Now to modify this and add more, and again, this is to your comfort zone, you can actually place your hand on the knee and gently push the knee gently towards the floor, and again, leaning forward. But again, you feel that tension, you feel that stretch. You don't want to go beyond that. You don't want to cause any increased pain in the hip, glute, or down the leg. You shouldn't feel any of this stuff. This stretch helps to reduce the tension around the pelvis, helps to improve hip mobility, decrease the stress through the spine, okay? So you want gentle, sustained stretching, nothing too aggressive. You want to hold this stretch for about 20 to 30 seconds while breathing normally. If you feel any increased symptoms, leg pain, back pressure, discomfort, you want to ease the position, come back a little bit. You should feel relief and controlled motion in this. Now, let's bring this all home and stuff. Let's understand this. When it comes to the problems of sciatica, it's understanding what is causing it. And that's an important thing. So your practitioner needs to have a good analysis system to understand how they want to address this. Without a great analysis system, you have zero direction and you have zero clarity. And clarity is what you need on this to help address this. So hopefully you found this educational. My name is Dr. Alykhan Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center, and I'm going to encourage you to like and subscribe to this channel because I continue to put more content on when it comes to discs and how you can manage them and how you can improve your spinal health. Looking forward to seeing you on the next video.